Origin brings together a multidisciplinary team. Across Europe, we have partners that have experience and are leaders in their field in photonics, particle physics, biomedical engineering, oncology, and medical physics. This is very important for making sure that the overall goals of the project can be achieved. My name is Sinead O'Keefe. I'm a Royal Society, Science Foundation Ireland University Research Fellow at the University of Limerick, and I'm the coordinator of the Origin project.
My name is Professor Kevin Price. I'm a researcher based here at the Patrick G. Johnson Centre, Queen's University, Belfast.
My name is Daniel Latorre and I'm a medical physicist at Central University Hospital of Asturias in the north of Spain. My team is in charge of checking the new system in a clinical environment, as well as advising on the system integration in clinical workflows.
My name is Michael Martin. I'm a research medical physicist working on the Origin project, and I'm based in the Galway Clinic on the west coast of Ireland, which is part of the Blackrock Health Group.
My name is Orla Houlihan. I'm a doctor, a clinical fellow at Queen's University Belfast.
My name is Professor Sunil Jain. I'm a consultant clinical oncologist at the Belfast Trust and Queen's University Belfast. I specialise in the treatment of prostate cancer, including treatment with prostate brachytherapy.
My name is Francis Beukmans. I am a professor of physics and photonics at Vrije Universiteit Brussels, or VUB. In Origin, we are in charge of manufacturing and assembling the very small fiber optic based scintillating probes for both low dose rate and high dose rate brachytherapy.
My name is Massimo Caccia. I'm full professor of experimental physics at Università dell'Insubria in Como. I'm a particle physicist. I'm a data analyst by mindset. I'm a silicon technologist because I'm an experimentalist. And my main role here is to have the honor and the duty to lead the team that has been designing, constructing and commissioning the system for the real-time dosimetry, that is to say the essence, technological essence of Origin.
Origin is a research project funded by the European Union's Horizon 2020 Research and Innovation Programme. This is funded as part of an initiative with the Photonics Public-Private Partnership.
It is a highly exciting project with a large level of investment from the European Union to deliver what we hope will ultimately become a practice-changing hardware with in-vivo dosimetry.
Origin is a project that's trying to improve the way that we deliver radiation-based therapy into patients, and particularly when it's delivered as a form that we call brachytherapy. So brachytherapy involves the direct insertion of radioactive sources into a tumour. That could be a prostate tumour or a gynecological tumour. And to be able to do that as effectively as possible, we need to be able to quantify the radiation dose that's delivered into that tumour.
Today what you do, you take an image of the area, the volume to be treated, then through mathematical simulation you know which is the dose that you want to deliver, and you have a limited access to what is ongoing in reality compared to what you presume it would have happened. Now with Origin we turn this assumption into a set of measurement, so we know actually by measuring what is ongoing, and we can feed it back and optimize the treatment through the optimal care of the patient.
So for me, I treat prostate cancer patients, and there are two types of prostate brachytherapy. Low dose rate brachytherapy, where we implant radioactive seeds into the prostate that stay in the patient for the rest of their lives, but they emit the radiation over a period of about a year. And there's also high dose rate brachytherapy, where we place plastic catheters or plastic tubes into the prostate gland, and then a radioactive source comes from a little bunker and goes into the prostate and delivers the radiotherapy over a period of 20 minutes.
In cervical brachytherapy, it takes place in a dedicated theatre under spinal anaesthetic. An applicator is inserted through the vagina into the uterus, and imaging is then performed in the form of CT and MRI. These images are then used to generate the brachytherapy plan, and during the treatment itself, a radioactive source is passed up through the applicator for a carefully calculated period of time to treat the cancer.
We can always do better, and we're always looking at how we can improve our treatments, and that's where research comes in and where big research projects that run throughout Europe come in.
While we know this is a safe, effective form of treatment for cancer, there are still some uncertainties associated with brachytherapy. For example, the bowel and the bladder could change in position, or the applicator may shift slightly, which could have an effect on the brachytherapy plan.
What we do is that we take images of the prostate 4 weeks before we do the procedure, and we use those to calculate the dose that will be delivered to the cancer. But it would be much better if we could get a readout of the dose on the day that we're actually doing the implant. If we could measure the dose in the prostate gland, in the organs surrounding the prostate, and we get the dose in real time, that allows us to adjust the dose to give the maximum dose to the cancer and the minimum dose to the surrounding tissues such as the bladder or the bowel to reduce side effects and to make the treatment as effective as possible. And that's what we want to be able to do through the Origin project.
Essentially what we're talking about is the development of an optical fibre-based radiation dosimetry platform, which enables real-time in vivo dosimetry measurements of the actual dose delivered to the patient, as opposed to relying solely on planned radiation doses.
We must make sure that all the sensors are identical and that they deliver the same response to make sure that the radiation dose delivered to the patients is measured accurately and consistently.
Fundamentally, the Origin system works on the concept of radioluminescence or scintillation. So a scintillator material is one which emits light or photons upon exposure to ionizing radiation. And the amount of light emitted, or the number of photons emitted, is proportional to the dose rate of the radiation source to which the scintillator material is exposed. Now, the Origin system really harnesses this physical characteristic of scintillator materials and uses it as the basis for our radiation dosimetry platform. So the scintillator material itself is then integrated into the optical fibre. So emitted photons propagate along this fibre to our detector system. And the specific detectors employed in Origin are silicon photomultipliers. These are semiconductor devices with excellent sensitivity, excellent photon detection efficiency, and small size. And each of these features make silicon photomultipliers particularly useful for applications in brachytherapy.
This is what we have been developing so far. This is a 16-channel SIM system because in order to be able to reconstruct the map, you have to probe the irradiation and the dose in several points. What lies behind this piece of metal are one of the highest sensitivity instruments for sensing light that mankind ever invented. These are called silicon photomultipliers. Anytime you get a photon, the quantum of light, these little toys have eyes that are so sensitive that are able actually to detect it. So what we're going to do within Origin is to have probes that are turning X and gamma rays into visible light, which is driven by a bundle of optical fibers to the sensors. The sensors blink the eye whenever a photon is coming, and they turn sampling of the photon flux into a measurement of the dose.
This new technology will allow for the independent verification of brachytherapy delivery, the comparison of institutional practice, and quality assurance of brachytherapy treatment provision, resulting in overall safer, more accurate clinical practice.
It is going to improve the quality of the data that hospitals worldwide compile on treatment outcome. And eventually this is going to provide doctors with very valuable information to personalize and adapt treatments.
This has a fantastic impact. It is expected to have a fantastic impact.
This technology really would be quite transformative in our ability to measure the dose when we're actually doing the treatment. And that just affects that balance, it moves it in the right direction, and hopefully in time we'll be able to cure more patients with more acceptable side effects. That's the aim of this Origin project.